I'm thrilled to be here at Christiana Care today to talk about issues that we have a lot of passion for, namely, how do we overcome the cultural barriers of medical training to help promote the quality and safety agenda? Let me tell you what I mean. I believe, as a medical educator for the last 25 years, that the training process that physicians go through, medical school, residency, fellowship, that the actual training process creates cultural barriers to our further understanding and acceptance of the tenets of quality and safety. If you teach physicians that they are autonomous decision makers, how can we then expect that years later they'll participate willingly and actively in a team-based environment? If you provide no training about the system's nature of care, the non-linearity about what it is we do every day, if you don't give physicians an opportunity to learn teamwork and leadership, how can we then expect that years later, when they're attendings, that they'll be able to join us in the hard, gut-wrenchingly difficult work of measuring and improving what it is we do every day? I firmly believe that doctors have two jobs every day when they come to work. Job one, the job of doctoring. Job two, improving job one. So how do we overcome some of these cultural barriers? Well, it's a tough issue. First, we've got to train the trainers, and that's in part what our program today is all about. We've got to diffuse this information deeper into the medical education continuum. We ought to be starting the first day of medical school, helping our students to understand that they're part of a larger system, that we don't ask them to be sole autonomous decision makers. We ought to have faculty promotion programs. We ought to have a research agenda that promotes all of the work in quality and safety. We ought to make this, in short, a very fabric of what the training process is all about. As the leadership of the Institute for Healthcare Improvement Boston have taught us, quality and safety are not electives. They ought to be a core component of what the training process is all about. These are some of the topics we're going to be talking about today here at Christiana Care. I'm also here to talk about the new Jefferson School of Population Health on the campus of Thomas Jefferson University. Of course, Jefferson Medical College is the medical school for the state of Delaware, and the newest school on our campus is the Jefferson School of Population Health. I see our school as part of the workforce development answer to overcoming the cultural barriers. Here's why. We're currently offering 3 master's degree programs, one in public health, one in health policy, and the second of its kind in the nation, a master's degree in healthcare quality and safety. This is open to all kinds of individuals, physicians, nurses, pharmacists, allied health personnel, and everybody else who shares our passion for measuring and improving the quality of medical care. Only through a concerted workforce development effort will we create a cadre of leaders who will then diffuse into the medical education continuum and build the kind of doctor of the future that we need. In conclusion, the cultural barriers to quality and safety are real. They come from our current training process. This means we have to look in the mirror, do the difficult work of self-evaluation, and figure out how to change the culture that we are all a part of. I'm very happy to be here today to help launch this conversation and to describe in more detail the Jefferson School of Population Health. Thank you very much.